Hello, everyone. I'm Dr. Renee. Thank you so much for joining Zoom in with Renee. Today's video is on the webinar that was held recently on diabetes management through Ayurveda, Naturopathy, and traditional Chinese medicine. It was organized by the Indian American Forum, whose founder chairperson is Mrs. Indu Jaiswal, along with Rainbow Media, that's me, yours truly. The speakers were Dr. Somesh Kaushik and Dr. Neeru Kaushik. The facts on diabetes are absolutely staggering and mind-blowing. It's the 8th leading cause of death in the United States. According to the Centers for Disease Control and Prevention, around 11.3% of the population is diagnosed with diabetes. 1 out of every 4 US dollars in healthcare costs goes towards diabetes care. $327 billion are spent on medical costs and lost work and wages. And when we look at the picture worldwide, it's 1 out of 10 diagnosed with diabetes. This is a critical healthcare issue, and this webinar is intended to bring an exponential awareness about lifestyle changes for successful outcomes. Prevention, early intervention is the key, because we know there is a direct link between diabetes and obesity, improper diet, and sedentary lifestyle. Today's video looks at diabetes through the lens of Ayurveda, Naturopathy, and traditional Chinese medicine. Let's take a look. And my co-moderator is Dr. Bhavani Srinivasan, like last time. Thank you so much for Dr. Bhavani for joining us today. We're all looking at different time zones and different locations today. So let me go first to Mrs. Indu Jaiswal, who is right now in India, who's the founder chair of the Indian American Forum. She has over 40 years of practice as a registered dietitian and a nutritionist, and a very strong community activist.
Namaste, good morning, everyone. I want to welcome the Kaushiks, our special panel speakers. Renee, thanks to you, and Dr. Bhavani Srinivasan. I'm in India, and everybody talks about Ayurveda. That's what they're talking about, alternative medicine and the treatment of diabetes. It is, people are talking about here too. So it's very, very important. And the more we talk about it, the more information we can exchange, the more, we can, explain to people how the food works, how the medication works. It will be helpful in controlling diabetes. It is an epidemic, and no matter through Ayurveda or through the natural, supplements that we take and the medication, we are able to control. That's our goal. And as a dietitian, I see it all the time. So I want to thank all of you for joining in today, and really looking forward for a very, very great and interesting, seminar. Thank you so much.
Thank you, Mrs. Jaiswal, and safe travels in India. We'll catch up with you when you get back to US. Dr. Bhavani is my co-moderator, and Mrs. Neelima Madan is my co-host. I just want to introduce Dr. Bhavani Srinivasan. She is a certified pediatrician in Long Island, New York, and she also practices Chinese medicine. Dr. Bhavani is also the Women's Chair for the American Association of Physicians of Indian Origin, that's API, in Long Island and Queens chapter.
Thank you, Dr. Renee. I'm happy to be here, and yes, so happy that we are introducing this super important topic, and and this very lovely morning to all of you. It's important from all countries' point of view, whether you're in the US, whether you're in India, or any part of Asia, because Asians in particular seem to be extremely prone to diabetes. I'm so glad that Ayurveda is now addressing this, because so far only people have only been thinking of allopathic medicine as not curative, mind you, but from a management point of view. So Ayurveda has so I'm so glad it's getting a place now, getting prominence, and it's being talked about and it's being advocated. So thanks to Doctors Somesh and Neeru Kaushik for being here on this program. I should say a word about our host, Dr. Renee Mehra. She's a doctorate in public health, and she's an award-winning celebrity, broadcaster, a digital creator. She's a voiceover artist. And most importantly, she is a tireless and dedicated community activist. She serves on many, many civic boards and nonprofits. We are so glad that Renee, you're here, that you're putting together these programs, and we're all able to listen and partake and learn. Over to you, Renee.
Thank you so much, Dr. Bhavani Srinivasan. We want to now move on to our speakers, because this is such a very important topic, and to underscore the significance of diabetes management. So I want to introduce my first speaker is Dr. Somesh Kaushik, Bachelor's in Ayurvedic Medicine Surgery, that's BAMS, from India. He has a Master's in Public Health and Public Administration from the University of Alabama. He is the president of the NCCBAM organization, which is National Certification and Credentialing Board for Ayurvedic Medicine in the United States. He has over 40 years of clinical experience, and he gives regular talks in many, many academic institutions on the benefits of Ayurveda and naturopathy. Over to you, Dr. Somesh Kaushik.
Thank you, Dr. Renee, and thank you, Dr. Bhavani, Ms. Jaiswal, for inviting us to this panel and this discussion about a very important topic, which is actually close to heart, because coming from India, there are so many people there. Actually, India is the capital of diabetes, so it's just we find so many individuals who are suffering from this condition. In Ayurvedic medicine, we always look at the individual. The disease is not the important part. Importance is for the individual. So, like Dr. Bhavani said, generally we are looking at the modern medicine to manage the disease, but Ayurveda does not manage disease. It manages the person. And in that case, Ayurvedic medicine is the personalized medicine. Everything is for that particular patient. Nothing, there are a few herbs which are used for that disease, but we choose the diet, the lifestyle, the supplement based on that individual. What that means, we believe in the 5-element theory, that everything is made of 5 elements: space, air, fire, water, and earth. And combination of those 5 create 3 doshas we call the body constitution or body types. So one, which is the combination of space and air, is vata dosha. Combination of fire and water is pitta, and combination of water and earth is kapha. So water and earth, when we combine them, that basically becomes mud. So that creates structure, which means all the bones, all the ligaments, all the tissue, all the fat, what we look like, is coming from the kapha dosh, whereas the pitta, which is the water and fire, controls all the metabolism, all the hormones, all the enzyme, entire endocrine system. So looking at that, we are looking at the endocrine system. That's where we are. That's what we are talking about. So in that case, that is controlling the enzymes, all the hormones produced. But vata dosha, which is the combination of space and air, in that case, all the movement, because air is the only thing which is moving, and so that controls the movement. Yes, sorry about that little time. So basically, air control all the movement. Whatever is moving externally or internally is all controlled by vata or vata. So air control the circulation of blood, circulation of lymph, which is cardiovascular system, circulation of motor sensory pathways, which is nervous system, circulation of mood, for the gas exchanges in the lungs and the cellular level respiratory system, filtration of the kidneys, movement of food from mouth to anus direction, all that is controlled by vata. So in that case, when we're looking at any condition, then any of those could be the cause. Could be kapha could be cause, vata could be cause, or vata or pitta could be cause. But looking at these, also we look at the pitta, which is the main thing in the transformation energy, which means that transforms the food. That is the agni, that is the heat, that is the metabolic energy. And that is what we need to concentrate on when we come to any disease, and particularly in case of diabetes. So in diabetes, we're looking at the spleen, we're looking at the pancreas as the main organ, but Ayurvedic medicine says it's just not one organ. They all work together. So looking at the pancreas, looking at the liver, is all the metabolic energy have to work together. So it's not what you eat, is also what you absorb. So first organ we look at is the digestive tract, and based on that, we are able to balance the doshas. We're able to bring everything to balance. We are also able to cure or treat whatever can be done based on how deep the disease has gone. So in that case, when looking at the overview, improper blood circulation that will attribute to the vata dosh can be caused due to poor food choices, stress, anxiety. While vata plays a major role, all three doshas are important. So blood itself is pitta dosh, and pitta is also controlling all the endocrine system. So that is something we need to keep in mind when we come to the doshas. Then we look at the dhatus. There are 7 dhatus, or the body tissues. Whatever we eat, depending upon our agni or metabolic energy, in 3 to 5 days, extract of that will nourish our body fluid. And we know 70% of the body is fluid by nature. Then depending upon the agni of the rasas, in 3 to 5 days, extract of those will nourish the blood. And then blood will nourish the tissues, tissues will nourish the fat, fat will nourish the bone, bone will nourish the bone marrow, and also genetic material. And then eventually essence of all of that is called oja, is the pure essence, and also we call the immune system. So we need to keep in mind the 3 doshas and the 7 dhatus. And when we look at the diabetes, it is the dosha of the meda dhatu. So basically it is deeper, almost in the middle of all the dhatus, but the meda, which is made of mostly kapha, is the one which is blocking all the channels, blocking all the pathways. So in generally, individuals who are diabetic, it is easy for them to gain weight, and that's what meda or the fat is. So fat plays an important role, and that's why the first thing we always talk about, that person who is gaining weight or becoming obese have probability of becoming diabetic also. And because of that, the new term which came over 20 years ago from WHO, we call the diabesity. Obesity and the diabetes came together. So most of individuals who are actually obese also have the probability of developing diabetes or the diabesity. So generally, when we're looking at the genetic part, looking at the obesity part, it is found that 90% of individuals who are suffering from type 2 diabetes actually are obese. And then we come to the autoimmune, which are found that 75% of the individuals with type 2 also have antibodies. So in that case, again, when we look at the autoimmunity, kapha or the kapha dhatu, kapha is actually playing big role in the immune system. So basically that is somehow is affected. So we need to keep in mind that all 3 doshas, vata, pitta, kapha, individuals with those can have diabetes, but mainly it is the fat, meda dhatu, which is obstructing the channels, and that's where it is developing. So in that case, when we look at the control, then we come back to that part also. In Ayurvedic medicine, we're looking at the lifestyle is main thing. Addiction to the sedentary habits, excessive sleep, sluggish and heavy food like curds, meats, and also milk product. Again, milk product have been used in Ayurvedic medicine for a long period of time, but the milk we find nowadays, especially in this country, is because of the pasteurization, because of all the preservatives, that actually is causing more problem. Also, the grain, wheat has been used in different parts of the world for so long, then became a genetically modified wheat, and that has become a problem. Corn has the same thing. So all the genetic modification. So when we talk about those grain, is the grain what we find nowadays. Freshly prepared alcoholic drinks, freshly harvested food articles, and all the things which aggravate kapha. It could be the heavy, rich, cheesy foods, red meat, lot of things which are fried. So all those things are going to increase kapha. And stress is the number one factor which affects our health the most. We know that the physiology is unknown, but again, everything is caused by somewhere, some kind of stress, and everybody is stressed. Even a kindergartner has so much stress because of homework. And so many of these conditions are actually are there, which are part of the modern lifestyle. And so we need to learn how to manage those. Once we learn to manage those, then many of the conditions we can reverse, or at least we can manage better. Again, like Dr. Bhavani just said, the modern medicine is the key. But again, we are trying to teach a 6,000-7,000-year-old Ayurvedic system to compare with a relatively new modern system, because that is the language we understand now. So in that case, whatever we are finding in Ayurvedic medicine, we have to relate that somehow to the allopathic medicine, because that has become the standard. Again, the trend is moving. So instead of calling it alternative medicine, we are looking for integration, because what we see that the modern medicine has done a great job in managing the diseases. But again, the consumer is looking for management of the person. So we are trying to integrate the allopathic medicine into with the Ayurvedic medicine, Chinese medicine, homeopathic medicine, whatever works for the patient. Again, we can combine all those and come up with a solution which will help our patients. So we're looking at the core causes, different doshas having entered the urinary tract. Invitation condition causes following three categories, which we call prameha or diabetes. Cough vitiates meda, mamsa, and kleda. Also, pith aggravates all by hot things. Again, hot just not by temperature, but hot which are producing heat inside the body. And simple thing is, for example, if we take yogurt, that is cooling by nature. And if we take milk, that is warming by nature. If we take black pepper, there's cooling by nature, which is still hot, but it's cooling by nature. If we take the chili, red pepper, it is hot by nature. So we need to be looking at the effect after absorption. So when we eat something, when it is absorbed, what it will produce inside my body. And that's what we're looking at. Cough and pitta are relatively diminished. Aggravated vata draws tissue elements, which means basically it is the vat which goes deeper. This vat is the only thing control all the movement. So basically any diabetic condition caused by the vat dosh is the deepest one and is considered difficult or almost impossible to treat or cure, because it requires a very dedicated management from the or involvement from the physician, the patient, and also the family, because it becomes a teamwork, because everything has to be changed. And most of the time is the person or the individual who will say, I can't do that because so much change of my lifestyle. So in Ayurvedic medicine, when we look at the treatment plan, we always look at the ahar, vihar, and aushadhi. First thing is, why not change what you eat? And then look at your lifestyle. And if your lifestyle is something which is causing the problem, for example, now there are television 24 hours a day and their iPhones and all these things, and children or adults are sitting on their phone until like 12 o'clock in the night. And I see many individuals who are retired, even though they are free, but they are sitting and watching television until 2 a.m. That causes a problem. So Ayurvedic medicine always talks about the circadian rhythm of the nature. And we say that basically between 10 to 2 p.m., 10 p.m. you should be sleeping. So 9:30, you should be in the bed. And 10 to 2 p.m., which is the pitta time, that is the time when body is repairing from the damage we have caused or done during the day. And if you're not sleeping at that time, then the repair man has come and gone, and you could not repair all the damage done to this body. So we always talk about the 6 a.m. to 10 a.m., 6 p.m. to 10 p.m. kapha time, 10 a.m. to 2 p.m. or 10 p.m. to 2 a.m. pitta time, and then 2 p.m. to 6 p.m. and then 2 a.m. to 6 a.m. is the vata time. So the morning and evening vata time is the time to connect with ourselves, yoga, tai chi, exercise, meditation. Pitta time, 12 o'clock, 1 o'clock is perfect time for lunch, because the metabolic energy, the fire is agony is the peak. And then the same thing in the night is for repair, all the damage done between 10 p.m. to 2 a.m. You should be sleeping soundly so that repair can be done. And nourishing time in the morning between 6 and 10, which means 7, 8 o'clock is a perfect time for breakfast. And same thing, 7, 8 p.m. is the perfect time for dinner. After that, you should not eat. let body digest, go for a little walk. So it's your lifestyle. Again, if just basically that need to be followed. Again, this is not only diabetes, any condition you talk about, as long as we follow those guidelines of Ayurveda, then it is basically rarely we will get any kind of disease. Again, diabetes, hypertension, high cholesterol, all these go together. And it's not only diabetes, the complication. The reason diabetes became so difficult to cure or reverse, because it's a multi-organ disease. We are dealing with the digestive tract, we are dealing with endocrine system, we're dealing with the urinary system, we're dealing with the cardiovascular system. And then when you come to neuropathy, we're dealing with the nervous system. So all these systems involved became so difficult to manage in the modern time because of the specialized system. You can't deal with 5 specialists at the same time. So in that case, the management becomes the issue. So kapha cause 10 types of diabetes, which is curable. Again, is obstruction. As we open the obstruction, as we move the kapha, then we can manage them. Again, that is managed by the diet and also by the lifestyle. Pitta causes 6 types, which is manageable and also reversible. So like I said before, kapha and pitta are basically their moods. So in Ayurveda, we always say that pitta pangu, kapha pangu, pangavomal dhatva, vayu na yatra niyantr tatra gachanti megvat. It is the vayu which makes them move. Pitta and kapha does not move. Anything which is moving inside and outside is all about by the air, vata. And the most important vata is the prana vayu. So in that case, when we are doing meditation and taking deep breaths, that is the first thing we are inhaling to bring prana, the life force inside. So vata parmeya are 4 types and are considered incurable or difficult to manage. And so in that case, the condition or the symptoms shown here are for the kapha. Again, the urine resembling water, sugarcane juice, heavy density, and all these are different types. And we're looking at the pitta, 6 types, urine resembling solutions of alkalines. Now look at the black color, indigo color, yellow like turmeric, reddish color, or having blood. And then we're looking at the vata, which is the most deeper. 2 categories. Vayu remains aggravated from the beginning, and vayu gets aggravated later. So in that case, it is again every time it is there is also containing kapha and pitta with it. So when we talk about vayu, it is also 3 doshic. Any condition which involves 3 doshas becomes difficult to manage or difficult to cure. So in both, again, if it's from birth, that is again incurable and genetics. But again, many times we talk about genetic predisposition, even though child is not born with the diabetes, but if they develop later on, it becomes difficult to manage. But if there is a family history and person saying, well, we have a family history, so I'm going to get one. If you don't have, you can manage it and you can prevent it. And that is where Ayurveda specializes it. And what is genetics? So in Ayurveda, when we talk about all these 7 dhatu, ras, rakt, mams, med, asthi, majja, shukra, whatever we are eating helps turning into the rasas, and then the blood, tissue, fat. So in generally, what we see in a family, I eat the same food which my father used to eat because I learned eating with him in his plate. He was eating exactly the same thing which his mother, my grandma, was making for my grandpa, and then my father was eating the same food. So certain foods become part of our tradition, and thus we keep eating, thinking this is the best food because my mom makes the best food. Everybody loves mom's food. So in that case, we keep eating the same food, thinking it is the best food, and somewhere there is a problem in the food itself, preparation of the food, and how we are eating it. For example, coming from India, again, from many of the individuals, they are high in potatoes. Is the cheapest vegetable, and we are just eating so much potatoes. And not only potatoes, when you're trying to make it tasty, then we are cooking them, putting some yogurt into it, just because it becomes like a chaat, becomes very tasty, and it's cooked in very cheap oil. So all that combination, and again, a lot of the there's rice or all the genetic modified wheat. So and then lifestyle is very sedentary. So that is also need to be looking at what we are eating. So the old saying is you are what you eat, and that makes sense. Also in Ayurveda, again, time I know is kind of limited, rasas play a big role. So basically in Ayurveda, there are 6 rasa, Madhur, Amala, Lavan, Katu, Tikt, Kushai. Basically, if you look at those rasa, those management of those is very important. So we have the sweet, sour, salty, bitter, pungent, and astringent. And that is how they should be eaten. So in the older times, I've seen when I was a little kid in India, and then all these older people will come, you serve them sweet first. They will take kheer or laddus or jalebis, and they will eat them first. And that made sense, since we know that there is a lot of acid or digestive enzyme sitting in the stomach waiting for the food, and you eat heavy food first so that can be broken down by all that acid which is produced by the lining of the stomach. But now we take soup or we take salad in the beginning, and all those digestive enzymes and acids are wasted with something which does not require anything to absorb. It's so light anyway. By the time we eat dessert at the end, there's nothing left, and that heavy cheese is sitting on the stomach, not be able to digest. So in that case, it is very important we take sweet first, then sour, then salty, then bitter, then pungent and astringent. So again, there is tradition again in India that we used to give fennel at the end, and that was the reason, because it's astringent in taste, and also we choose ginger. So we start your day with ginger and end your day with ginger, and that will actually help in basically managing the excessive sugar floating in the body, and also stimulate the pancreatic islet of Langerhans and also the production of insulin. And so in that case, we can change our lifestyle, change our diet, and manage some of that. So briefly, some supplement, we'll discuss those when we actually have a question and answer. Diabetes support, Gymnema actually is a really good herb used all over the world, in anywhere where we use natural medicine. So basically, Gudmar is the common name that is very used. Fenugreek, methi is used a lot. Cinnamon, triphala, Hapalotone, neem, boswellia, manjista, curcumin, turmeric, haldi, we use that all the time. Gugulu, chemophormocol is used. So many of those we are using in Ayurvedic medicine. Of course, now they are not raw herbs, we standardize them. And the purity of herbs make a big importance. And so there are a lot of things which we can offer. But again, ultimate thing is, if the person have other conditions also, coexisting condition, they need to be taken care of also. So with the combination of all that, Ayurvedic medicine definitely can help. Again, thank you, Dr. Renee, and thank you, Dr. Bhavani, for having me.
Thank you very much, Dr. Kaushik. And we will be we'll take the questions for both the Kaushiks after the presentations. And I want to now introduce, this is Dr. Neeru Kaushik. She is the Chief Medical Officer at the Institute for Ayurvedic and Naturopathic Therapies in Fairfield, Connecticut. She earned her Doctor of Naturopathic Medicine degree from the University of Bridgeport College of Naturopathic Medicine. That was in 2006. She's trained in acupuncture, Ayurveda, as well as iridology and homeopathy. She has worked as a Sanskrit instructor at the Institute of Ayurvedic Sciences in Alabama, and where she also taught Ayurvedic cooking. Over to you, Dr. Neeru Kaushik.
Hi, good morning, everyone. Thank you, Dr. Renee, Dr. Bhavani. As we already discussed about the diabetes, so I will not take much of time and come to the point. So I will talk about the TCM theories, which include yin and yang, and 5 element theories. So yin and yang, which is complementary to each other, and which describes how the things function in relation to us inside the body and in the universe. So they are interdependent on each other, yin and yang. There is a yin in the yang, the seed of yin in the yang, and vice versa. There is no absolute. For example, in the day and night, we have evening, which is the yin seed in the yang. So it's vice versa as well, like dawn before we have the bright day. So the yin we describe as like colder, passive, downwards, inwards. It's a hilly side, it's a like shady side of a hill, which is, we've described the yin. And yang on the other side, which is more of like warmer and more of like activeness, more of alertness, and more of like forceful movement, which is more of the yang. So there are the yin also represent organs and yang also represent organs. The yin organs are all the solid organs, like you can see on the screen, that lung, spleen, heart, kidney, pericardium, and liver, which is yin organs. And yang organs, which is more the hollow organs, is large intestine, stomach, small intestines, urinary bladder, sanjoy, which is another word is triple warmer, and gallbladder. So yin organs, they produce, they transfer, and they regulate our nutrition. And yang organs is, which is more of like produce the enzymes and ripen our food to digest and give nutrition to our body. And then we come to the 5-element theory. So it's like the picture or the, it's on your screen. If you will see, the 5-element theory is like same as the 5-element theory we have in Ayurveda, but it's like we, in Chinese medicine, we called it wood, and then fire, then earth, and then metal and water. They also associated with the organs, like wood related with the liver and gallbladder. One is yin organ and one is yang organ. And then the second, which is a fire, is related or associated with the heart and small intestine, and the earth, which is related with the spleen and the stomach, and metal, which is related with the lung and large intestine. On the same way, the water element, which is kidney and urinary bladder. If you will see in the picture, those are, they act on, generate, and promote. This is called the Sheng cycle. So like you will see the liver, it's promote the heart, heart promote the spleen, spleen promote the lung, and lungs promote the kidney. And the inner arrows, it shows, which is called the Qi cycle. And it shows like they act on and they control each other also. Like the liver, it control spleen, spleen control kidney, kidney control heart, and heart control the lung, and lung control the liver, and how the circle goes on. So there are like the prana we have in the Ayurvedic medicine. There is a chi in the Chinese medicine. So the chi means the prana which allow to move and maintain the activity of life in, and the free flow of the energy to regulate our body functions. So where the chi come from? There are two types of chi. There is one is congenital, which is prenatal, like we come from our parents, and other one is acquired, which is from our food and air. And this can explain why the proper diet, exercise, breathing is more necessity if you want to have the acquired chi. So normally the chi is the one, or prana, which is circulating continuously throughout the body for our body functions. And there are two types of disharmony as well in the chi, which is called the deficiency and stagnant. So deficiency of chi, which is like we have a lack of chi in the body, or there is not full flow. So lack of chi, we can see that somebody is tired, or like no like lack of movement, no motivation. And the stagnant of chi, we can describe as like there is an obstruction of the chi. So that we describe somebody having ache and pains in the body or in the joint. It's mean the chi is stagnant over there. So goal of TCM theory is the proper movement of flow of the chi inside the body. So the chi is considered the vital energies as prana or vata. Like there are 5 types of vata, Dr. Kaushik mentioned. So that where the chi flows, those chi flows in the 12 meridians. And those 12 meridian is associated with all our 12 organs, yin and yang, which I described before. So 6 with the yin and 6 with the yang. So that these are, you can say, the pathway or the channel where the chi flows. And the points, they have the pool of energy, which with the needles, we circulate the chi where with the clockwise insertion or anti-clockwise insertion, we can take care of the stagnant and deficiency of the qi in the body. So according to the TCM, there are two terms of the qi, of the diabetes. One is called Shio-K, which is wasting and thrusting. And the other one is Tang Nio binge, which is sugar urine illness, like too much sugar or too much, we see too much sugar in the urine. And they are divided in three types. So on the three levels. So upper Xiao is called the upper level, which is associated with our lung deficiency, and the middle, which is associated with our stomach deficiency, and lower, which is from our kidney. So which is organs main affective with the diabetes according to the TCM is lung, spleen and stomach, and then the kidney. So what's the lung deficiency means? The lung deficiency means that that patient have more of the thrust. So they have the restlessness, they have the polydipsia, dry mouth, tongue, lot of thrust, and their yellow coating and full rapid pulse because it's a lung yin deficiency. And treatment we do is clear with the help of acupuncture. We just moisten the lung and clear the heat. And same as in the middle middle level, which is more of the stomach and spleen level. So that's more of the hunger, like too much hunger involved. So patient is hungry all the time and they have a constipation, dry stool, and same red body and yellow coating and rapid. But here, if you will compare, because it's the middle jaw, so the difference here is the slippery tongue, which is more of the mucousy because of the mucus involved in that because of the spleen. And the treatment is also just take care of the fire and the mucus from the body and tonify the yin and increase the body fluid. And the last is the yin deficiency. So that is the lower level, and it's more mainly involved with the too much of urination. And usually we see in the diabetic patient, all three are involved. It's not like somebody will say, oh, I have only thrust or I have only frequent urination or something. Usually we have all three. So according to that, we use our points. So diet is mostly same as we have in Ayurveda. So like less greasy food, less overeating, and more of the herbs and more of the cooked vegetables, like in the form of soup, sauteed, steamed vegetables, not the raw vegetables. We can do the raw cheese. So there are like diabetes, like diabetes 1, diabetes 2, there is juvenile, and there is gestational also. So which like it can come prenatal also. They said that, oh, it's a genetic, but it's not really, it's depend on our food also. Like Dr. Kaushik mentioned, if we will change the food, if we will break that cycle, we can change our genetic cycle too. If we will not eat the same food again and again, if we will eat the variety of the food, we can change that and not prone to the diabetes anymore. And like he took the example of the potatoes. Like I see, especially in India, the people, or especially the kids, they love the potatoes, like he mentioned. But I see one more thing. They love the potatoes with the sweet peas and with the carrots. They all are high glycemic index. So that's the worst combination somebody can have if they are like family history of diabetes or if they are diabetic. So in acupuncture goal, we through the our acupuncture needles, which is metal needles, and we insert in the body on the meridian pathway to regulate the flow of our energy. So it can be, we will do the tonify yin deficiency or yang deficiency, because in that case we can have yin and yang both deficiency. And according to the TCM, we treat patients according to the 8 parameters, which is yin yang, hot and cold, deficiency or excess, and interior or exterior. That's we ask the question from the patients, how they feel, and observation, how they look, how is the pulse, how is the tongue, and the shape of the tongue, color of the tongue, how is their body type. And according to that, we just take the decision, what points we need to do. And we also use other modalities as plum blossom needles, we like tea chai, qigong, herbal products, and acupuncture points we do according to their symptoms and associated other symptoms or disease with it, because diabetes also followed hypertension. So if one person is diabetic, like within like few years or maybe 5-10 years, they can have the chances of having the hypertension as well. So the nutrition, in the nutrition, so I give more of like chromium, and encourage patient to just soak the methi seeds and have it in the, consume it in the empty stomach on the daily life. And exercise, of course, and meditation. So there are the few herbs. I'm more of the combination I'm doing of the Ayurvedic medicine, Chinese medicine, and homeopathy in that. So like whatever, it depends on the patient's body type.
Thank you very much, Dr. Neeru Kaushik. Thank you very much, Dr. Somesh Kaushik and Dr. Neeru Kaushik. And we're going to open up now the floor for questions. I also suggest please do read my research paper on diabetes, because I'm talking about meditation as an adjunct therapy. I'm talking about those who are also genetically predisposed to diabetes. There is hope, as both the Kaushiks talked about it, because if we change our lifestyles, more physical activity, proper diet, get our doshas in balance.
Dr. Bhavani, I appreciate the overview by Dr. Neeru. I do practice acupuncture myself, and I had a separate office for it, which I subsequently closed when COVID reached our shores. Mm-hmm. But that was a very nice overview that you gave, Dr. Neeru. Thank you for that.
Diabetes, there are many things which we can do. Again, use of ginger, use of garlic, use of fenugreek, use of turmeric on daily basis. So the old tradition was early morning we take charnamrit, which is basically a water in a copper glass or copper pot with a lot of tulsi, and we take that in the morning. Well, that was prevention. So many of the things which our ancestors started doing in home as made a part of our lifestyle or religion actually was for prevention. So tulsi soaked in water overnight on a copper pot. So it has copper, and it has the holy basil, which again is bitter and was very, very useful in that one. So any question anybody have, we'll go into detail for that.
A tea, which is a combination of which you mentioned fenugreek seeds, cinnamon, and turmeric. You make a tea of that, and in the morning, and you decant that, and you drink that supernatant liquid first thing in the morning. You know, like a cup of it. Tastes pretty nasty, but it seems to help people.
That is true. But again, when it comes to the Ayurvedic herbs, we also need to know the vipaka. Vipaka is the after effect and the carrier. So turmeric requires a carrier. Turmeric requires for absorption either fat or black pepper or bromelain. So turmeric became so popular, everybody started using turmeric in their chai, in their coffee, in their soup. But again, if there's no fat, if there's no black pepper, if there's no bromelain, it is not absorbed. So in this tea, if we put a pinch of black pepper, then the turmeric is useful.
I had a question. We always talk about early intervention, and prevention is the key for any chronic illness. When we're looking at diabetes, looking at the A1C levels, especially somebody may be genetically predisposed to help prevent diabetes, or you're going to look at just the lab reports?
So when the hemoglobin A1C, it's like usually they said that, okay, you are pre-diabetic if it's up to the 6, right? So we told the patient if it's like 5.6, we tell them they can even correct it only with the diet. So only, I think with that, if they will take the chromium supplements, which is one capsule, 200 milligram twice a day, morning and evening. And with that, if they just have more of the bitter melon, more of the methi leaves, right? And cut down the potatoes, carrot, and sweet peas from their diet, which is the very high glycemic index. And on the same time, introduce more of the bitter melon or karela and more of the okra and cooked vegetables in the soupy forms and more of protein like paneer, soy, tofu or soya beans, more beans, and just cut down their simple carbs and more of complex carbohydrates. Like instead of eating the whole wheat, we say it whole wheat in these days, but it's still like a lot of maida in there. So they can add little bit of their that's black chana flour in that, right? Little bit of the jowar or millet in there, and flax seeds in there. So in their flour, and make chapati out of it. So if they will pay just attention to and little bit of changes in their diet, so they really can correct it.
So to expand on that, when we're looking at the blood report, it is only second dhatu, right? Ras, Rakt, Mams, Med, Asthi, Majja, Shukra. So we're looking at the second dhatu only. But disease goes deeper. So in generally, when we're looking for a deeper information or clue for the disease, we do biopsy. So now what we do is a hair element test. And in that test, if you find your chromium level is low, even though there's no diagnosis yet, but you can see possibly you can develop diabetes. There is a genetic disposition. So why not change early in life so that you will never develop that condition? So keeping that in mind, the supplements are introduced. And also when we look at the lifestyle, like Dr. Neeru just said, when we are making for example, when making a bread, so instead of using a lot of corn or a lot of genetically modified wheat, why not make a mixed flour with almond, barley, soy, lentil, flaxseed? And we also pay attention to the glycemic index of the food. Wheat, for example, or white bread have a glycemic index of 100. So everything is compared to that. When you're looking at all these things, barley have glycemic index of 33. We're looking at all the soy have 20 only. So soybean flour, looking at the lentils, most of the lentils, mung bean or the red beans all have 36 or 37. Flaxseed, alsi, very low. So all these things, we combine them. And once in a while, if you add a little bit of wheat, a little bit of rice, that is okay. But again, not the majority of that. Also, well, like Dr. Neeru mentioned, the use of potatoes and carrot. Anytime you find things which are sweet or their byproduct is sweet, then in that case, we use different combination. So either you cook that with methi, a lot of bitter, or if you have to have aloo, make them with methi, make them with spinach, make them with batwa, make them with collard green, mustard green, any collard green. Also, when you're cooking them, then the use of ghee comes. Either use ghee or use mustard oil. So mustard oil is bitter. So you cannot use vegetable oil or olive oil or any sweet oil. So especially in a family where there is a history of diabetes, then anytime you're frying something, even though number one, don't fry. But if you have to, you may have to make puri for special occasion, then fry them with mustard oil, making potatoes, mustard oil, making okra, mustard oil, pumpkin, mustard oil, anything slimy, arbi, we make them. So all these things need to be used with mustard oil or use mustard oil for in the diet. But again, saffron is a good thing, or ghee actually is always good.
Is rock candy good as a good substitute for sugar?
Probably is much better. So in that case, when we're looking at the sugar, we always recommend stevia. You can use agave. And then after agave, use jaggery or gur. So if you can use a little bit of date sugar, that is also possible. Or then after that, drink some ginger tea, that will wash it out.
You had recommended having ginger first thing in the morning and last thing at night. So is it that people should chew fresh ginger? How should they How should they do
can
that?
chew, but we have incorporated, like when we go to work early in the morning, there's a ginger tea. So we are just drinking ginger tea, starting that, because you're sleeping in the night again. There are days where human beings, stressful days, stressful evening. So you try to stimulate yourself so that not only and basically stimulates the basically circulation, which is again cardiovascular, mental circulation, also balances all the hormones. So it also helps stimulate all the glands. So ginger with a little bit of fenugreek, cardamom, good for lungs, especially where the weather is changing. And that is the tea you start with. At the end of the day, you need to wash your esophagus, all that part with the warm liquid, which has astringent and pungent taste, so that the bacteria will not grow. Again, we do know that everything or most of disease, chronic disease, start from the gut. So overgrowth of bacteria is becoming a big issue. And in that case, if we are leaving a trace of food or trace of sweet in our digestive tract, upper tract especially, the bacteria will follow that, and people see a big thick white layer on their tongue growing in the morning, and the teeth mark on the tongue telling that the tongue has been inflamed. So at the end of the day, if having a half cup of ginger tea, that definitely will help.
But yeah, on the same time, like she asked, they can chew it. But yes, you can chew it, but you need to pay attention who's chewing that. The kapha people, if they are chewing, they will get more benefit. But if the pitta people, they can become little worse too. So it's depend what body type you have, and according to that, you need to put like the quantity of ginger. And fennel is okay because it's neutral and it's more of digestion. But ginger has like heat tendency. So if the pitta will take the same amount of ginger, which what kapha can handle, pitta cannot. So they need to be aware what their body type they have, and according to that, they use the ginger. So they cannot everybody cannot chew the ginger.
Well, thank you so very much, Dr. Somesh Kaushik and Dr. Neeru Kaushik, for sharing your knowledge of Ayurveda, naturopathy, acupuncture, Chinese medicine. I just wanted to ask you also, do you suggest homeopathy as well for diabetic patients?
I do more with the kids, not with the adults. Like, the kids who are under 2-year-old, so they cannot take the herbs, bitter herbs and all that, right? I cannot tell them to give them, Karela juice or something. So then I take a case and do the constitutional homeopathy.
I see. But there are a lot of sugar pills. Are they?
No, I don't do. I use the liquid.
I see. Okay. All right.
One drop on the tongue.
One drop under the tongue. So I don't use the sugar pellets.
I see. Okay. Well, thank you. Thank you. Dr. Bhavani, you have any other last question for our speakers?
No, I thought it was completely fascinating.
Yeah, it was absolutely.
Yeah.
Well, thank you so very much, Dr. Somesh Kaushik and Dr. Neeru Kaushik. And thank you, Dr. Bhavani, for being the co-moderator today, and Mrs. Neeru Ramadan and Indu Jaiswal. And I'm Dr. Renee Mehra. Stay healthy, stay positive.